Good morning, everyone. Welcome to this webinar, Drug Use in Europe, Trends, Challenges, and Preventive Solutions. Today, we have an important topic to discuss. In this session, we will hear from well-known and respected experts on drug situation in Europe and how we can prevent drug use. Before we begin, I would like to cover a few practical details. First, participants are welcome to ask questions using the Q&A function in Zoom, and we will address the questions after each presentation and time permitting. Second, the webinar will be recorded and the recording will be shared with all participants afterwards, and it will be publicly available for 2 weeks. Now, let's begin with the opening remarks from Juha Mikkonen, the Executive Director of EHYT. Juha holds a PhD in Health Policy and Management and has specialized in health promotion, in health inequalities, and substance abuse prevention. Juha, the stage is yours.
Okay, thank you, Heikki, and good morning to everyone. You can hear me, I guess? Yes, great. My name is Juha Mikkonen, as Heikki said, and I work as the Executive Director of EHYT, Finnish Association for Substance Abuse Prevention. And on behalf of EHYT, I warmly welcome you to today's seminar on drug use in Europe. We are here today because drug use and its associated challenges touch every corner of Europe. These challenges transcend borders, affect individuals, families, communities, and entire nations. As we confront these evolving trends in drug use, we must also address the social, economic, and health-related impacts. Today's seminar is not only about problems, it's also a conversation about solutions and hope. And today's seminar brings together experts and policymakers who are united by a shared commitment, the prevention of drug use through evidence-based and effective strategies. Throughout this session, we will hear from some of the prominent leaders in the field. First, our State Secretary Laura Rissanen will provide some insights into Finland's current investments in drug use prevention and some of the priorities that shape our national approach. And we are also privileged to have Giovanna Campello from the United Nations Office on Drugs and Crime. She will highlight some of the effective solutions on how we can improve our prevention work. And after that, Dr. Anna Bergenström from European Union's Drug Agency will present an overview of drug use trends across Europe, placing Finland in this broader context. And as a national speaker, we have Dr. Elina Kotovirta, who will give a commentary speech. She will focus on the drug situation in Finland and on the ongoing prevention efforts. For over 10 years, and Dr. Kotovirta has served as a ministerial advisor on drug policy at the Finnish Ministry of Social Affairs and Health. And finally, we hear from our own team here at EHYT, including Hanna Heikkilä, who will present some concrete actions that are already making a difference in substance abuse prevention. Each of these contributions will help us to explore not only the scope of the problem, but also the potential solutions that are grounded in collaboration and evidence-based practices. Once again, thank you for joining this seminar. Let's make the most of this opportunity to learn and inspire a meaningful change. And now I'm honored to give the floor to our State Secretary Laura Rissanen to share some of the perspectives on how Finland is investing in drug prevention. Thank you.
Thank you, Juha, and good morning to you all. I would like to start by thanking the organizers of the webinar that they have taken this important topic on the agenda today. I don't know if they knew that we would get the latest data on drug deaths in Finland from 2023, which are very alarming. The number of youth between 15 and 24 who died of drug use last year almost doubled. So we are dealing with a very grave situation in Finland, and it's a topic that is not a happy topic, and it's a topic that I think all of the society has to deal with, and the Finnish numbers are not very good in that sense. And as a mother of 2 pre-teenagers, I of course follow this on a personal level as well, and and I get the message that the children of today are getting from online and from sources that we as adults have no idea of what they might be talking about and hearing. Drug use prevention, especially among youth, is a tough challenge for all of us, whether we are prevention professionals, parents, as I said, or anyone who has the privilege of having children or young people in their immediate circle. I was asked today to speak on how we in Finland are investing in the prevention of drug use, and during these few words, I would like to describe some important elements of the Finnish prevention work. To keep this speech clear, I will mostly only use the word prevention when speaking about preventing harms and risks caused by substance use and addiction, which I guess is something that we all very well do. In Finland, prevention work has been developed systemically past 20 years. Very often when we think of prevention as adults, we only think of education of school children. We often hear prevention to be criticized of being judgmental and accuse it of using scare tactics by people who have no experience of how prevention is executed today. I think all of us have a memory of how it was done back in the day when we ourselves went to school. At least I can still recall the very judgmental lessons we had in the early 90s. And as with all things relating to school, people often think on how it was done back in the day and not without even trying to learn how it's done today. But modern prevention is much more than just disseminating information at schools. It's multifaceted, it has to be, an interdisciplinary activity aimed at preventing use and harms of all substances, alcohol, drugs, tobacco and nicotine products, and gambling, and promoting health and well-being across society. Prevention in Finland is conducted in various ways, and it encompasses several different approaches. Prevention is, of course, information sharing and communication, but also a variety of actions in municipalities, local communities, and social and healthcare services. Prevention is always collaboration and networking between different actors. And prevention can be supported by legislative measures. Finland is one of the few countries that has a specific law on substance use prevention. As we know, children and young people are a special target group for prevention work. Modern prevention work considers different risks and protective factors of young people's lives. Risk factors are things that increase the individual's risk of developing problematic behavior, such as lack of support within the family, poor school performance and negative school experiences, loneliness or absence of community networks, and low self-esteem and difficulty managing emotions. These are all things that I think they affect a lot of the lives of our children today, and we have to take this whole of being approach also to prevention work. Protective factors include, among others, supportive family relationships, positive school experience, community support, and the ability to recognize and manage one's emotions and having confidence in one's abilities and self-worth. Therefore, an important aspect of prevention work for young people is social reinforcement. It refers to factors and actions that strengthen an individual's social skills, self-esteem, and adaptability, as well as support their ability to function as a part of the community. One of the important goals of prevention measures is to equip individuals with the necessary skills to resist substance use and to make healthy choices. This is possible with efforts helping young people to develop a range of social and interpersonal skills that can help them navigate challenges and avoid risky behaviors. The goal of social reinforcement is to support an individual's well-being and adaptation to various social environments, as well as to prevent problems related with social skills and self-worth. But always, an important part of prevention is, of course, always education. The effectiveness of information sharing and public education has been debated and studied. What is the potential of substance use education to prevent use and harms? In practice, public education must have the power to influence. Scientists are routinely doubtful about the effectiveness of public education. But if you consider not the short-term impact of individual messages, but the combined effort of public education efforts over the longer period of time, we find that public education can make a difference. Of course, the youth of today, they get their information from sources that we are not able to affect. This also emphasizes the importance of public education. If information is only received through unofficial channels, we are on a slippery slope. Ladies and gentlemen, I know that many of you listening today are the ones who are developing new methods and constantly reviewing old methods to keep prevention work evolving according to the best practices and evidence. Quality of prevention is also regularly discussed on international fora, and best practices are shared, for example, among EU member states. National development work is done in the Finnish Institute for Health and Welfare and in the regional offices, well-being service, countries, and municipalities. During the whole history of Finnish prevention, NGOs have had a key role in developing and adapting new methods and supporting and cooperating with different actors. When I was talking about those pictures of the early 90s that I saw in schools, they were basically almost always different NGOs that were brought to schools to give lectures on substance use prevention. I hope this webinar will bring some new ideas to the Finnish prevention development, and I hope that even though maybe not all of those who were registered are not online today have the ability then to listen to the webinar and different lectures later on, as this will be online for a few weeks for people to see. I wish you all a very pleasant morning, and I look forward to hearing the new ideas that may come out of the webinar today. Thank you.
Thank you, Laura. It's great that you were able to be here and share some insights on the current development on Finnish drug policy and prevention work and how the state is helping us. And we did not know that the statistics will be published today. So this is good that we are discussing this topic right now in this session, and hopefully we will bring some new ideas how to turn these not so good statistics going down. So probably there will be new ideas and new information. But again, thank you, Laura, so much for being here. Next, we will continue with the program. I like to give the floor to Giovanna Campello. Giovanna has over 25 years of experience in the drug prevention, applying and contributing to scientific evidence. So Giovanna, please go ahead.
Thank you, Chair, and thank you, organizers, for having us, UNODC, and me specifically today to present you a little bit on evidence-based prevention as from the global point of view. I'm trying to share my screen. Maybe somebody can nod to confirm to me that the presentation is online. And what I will basically do is to present to you the content of this publication, which is our standards. That is the standards where we summarize the scientific evidence on what works in prevention. Our distinguished opening guest. The State Secretary already gave us a masterclass on the vulnerabilities that make especially young people more vulnerable to starting to use drugs and maybe develop a drug use disorder. I think this is from the other way around. We just looked at what really worked, but you will see that this is really very much a mirror image, and that you will find a lot that she has already mentioned reflected on what the science tells us works in drug use prevention. Let me also underline that by now the standards are a tiny bit old. They were the second edition that we published together with the World Health Organization was published in 2018. But rest assured that we are not sleeping on this beautiful document. We have recently undertaken a systematic review of the reviews. We have not published yet, but I really wanted to see if there was anything at the broad level that is moving. I didn't find, with a couple of exceptions that I will talk about at the end of this presentation, I didn't find anything breathtaking. What I'm going to present, I just want to reassure you, even if the publication is from 2018, is still very, very relevant. The reason why we did this publication is precisely what the State Secretary mentioned, that the effectiveness of prevention was debated. And while I knew that there was a lot of science telling us that good prevention is actually very, very effective, and I wanted to contribute to this debate, maybe put it to rest and really present the evidence that prevention of drug use is effective. Let me tell you a tiny bit about how we developed the standards, just for you to be reassured that we were not alone. We had experts from many countries, and we did follow a very systematic and rigorous process, according also to the WHO guidelines. And this is the process presented in a systematic way. This is a simplified version. We searched the scientific databases, of course, but we also collected studies from experts from all over the world. I say it doesn't matter whichever language. We find a way to translate. That time Google Translate was not working that well, but we managed. And we selected the relevant studies. We selected the studies with a strong methodology, and this is at the basis of the standards. And let me show you an example of these studies, just to bring to your attention a couple of ideas. This is a study of an intervention. It's written very small here in preschool. This means that the kids that the program worked with were 2 to 5 years of age, really tiny. The study followed a group of kids, which is in blue, until they were, that did the program, until they were 21 years of age. And also a group of kids that did not do the program. They followed to the same age. And you can see here how at 21 years of age, by then young people that had done the intervention, had participated in intervention in preschools, used marijuana less. There were less prevalence of teenage pregnancy and higher prevalence of enrollment into college and universities. So just to reinforce what the State Secretary was already mentioning, when we talk about prevention of drug use, this is what we are talking about. We are talking about really being effective in avoiding the people start, and if they start, to avoid that they progress to a drug use disorder. Of course, there will be people that do start, and for them, there needs to be a continuum of services, from harm reduction to treatment to recovery support, to make sure to promote and protect their health and recovery. But the standards as such, the one that I am presenting today, are really about preventing the initiation of drug use. But there are some very good news. So there are many strategies that have been found to be effective in preventing drug use, and not only drug use. we also know that whatever we do, evidence-based prevention is effective in preventing other risky behaviors as well. And that is, of course, if you think about it, if you think about the vulnerabilities that the State Secretary mentioned, they are at the basis of many risky behaviors, not only drug use and drug use disorders. And so it should be of no surprise that if you do prevention well, you're preventing drug use, but also other risky behaviors. You're really supporting the health and safe development of children and youth. This is the list of activities. I will not go through it in detail. We have no time, and it might also be a bit tedious. You can read the standards, of course, but I will present to you some messages. And for now, let me bring to your attention a couple of things. There are many interventions, like we were saying. There are interventions that cover all of the stages of development and adulthood. And there are interventions in many different settings that we can work on. And as I was mentioning, we are not only preventing drug use, we are preventing many risky behaviors with evidence-based prevention. And we also are saving money. Evidence-based prevention is cost-effective. I usually quote this calculation. It's a very conservative calculation. It's easy to remember, but just to say that by preventing drug use and other risky behaviors, we save the society as a whole, saves a lot in terms of health and social and crime, criminal justice costs. How does evidence-based prevention look like? Looking at my watch, I've organized this around a few messages. The first one is the earlier, the better. And this is something that is still very much not, it's not accepted. We had even a very important resolution a couple of years ago in which all of the member states of the United Nations agreed that we need to look at early prevention in early ages. But it's still not as implemented as much as it should. Suffice to say for now that there are many interventions in very early stages of life that will prevent drug use and drug use disorder later in life. So starting from when the baby is still not born. There are services for pregnant women, including treatment of drug use disorder, if any, voluntary and evidence-based, of course, supporting young mothers that are in particularly marginalized situations with prenatal visit, early childhood education. That is the graph that I just showed you. This is from a program like this. And then when the children start to go into primary school, there is a lot that can be done in the classroom environment to develop their social and emotional skills and address any early onset of mental health condition that might be appearing at that age. Second message, focus more on development, not only information. I'm almost tempted to skip this part because this is something that the State Secretary already mentioned, but it gives me the opportunity to talk about one particular kind of intervention that we think is very, very important and that precisely supports the development of children, which is parenting skills or family skills programs. These are programs that help parents to be better parents in very simple ways. No lectures like I'm doing to you now, right? But games, being together, strengthening the family bonds, giving parents those easy tips to be able to monitor and be involved in the lives of their children in a positive and effective way, and also, provide limits in appropriate and effective discipline. These kind of programs are effective in preventing substance and drug use, and many other risky behaviors. They are effective in violent communities. These are data from our implementation all around the world. They are effective in very poor communities. They are effective among displaced populations. We have used this with refugees, either in camps or embedded in the life of many countries. They are the kind of prevention that more consistently benefits both girls and boys. And this is consistent with what we know of the etiology. And we have very good data from our colleagues in WHO that shows that this kind of programs are effective in preventing violence, particularly youth violence. They are effective in preventing child maltreatment and promote mental health also in very, very difficult circumstances. And they are recommended as part of a bigger comprehensive response to domestic violence against women. So really, really powerful tool. And it's such a powerful tool that we have developed our own programs so that they are available to everybody in the public domain without having to pay costly royalties to universities. These are programs that we have been using all around the world. And I will just mention, because I know that we will go into more detail, that we are really, really proud to be partnering with the organizers of this webinar in piloting Family United in Finland. And we are really looking forward to this collaboration. We also have a lot of materials that are derived from this kind of science, and that is specifically targeting parenting during very stressful circumstances and where we cannot arrive with a group program, but still there are many different ways online and not, sometimes even in the bread wrappers in refugees camps. There are many, many different ways to reach parents with tips on how to cope with their own stress in difficult circumstances and be that protective and resilience force in the life of their children. I said the earlier the better, right? But it's also never too late. Sorry to be banging on the cliches, but of course, I don't want to give the impression that we should be doing prevention only in the early ages. They are very, very important. This prevention is not done enough, but there is a lot that can and should be done in adolescence and adulthood so that everybody's health is protected and promoted. And we are talking about preventive education, but also school policies, especially around attachment, enforcing those alcohol and tobacco policies. I know Finland is very strong on this. I don't need to preach to the converted on this. Please keep on going. But also there is a lot that can be done in various settings, the workplace, entertainment venue, and try and reach everywhere with screening and brief intervention to find the people that have not developed a drug use disorder yet, but they have started to use and would benefit for a non-judgmental chat as to, how about your health? Do we want to think about that as well? And if there is a drug use disorder program, put them in contact and motivate them to enter a therapeutic process. The other message that I have from the standards is to use evidence-based programs. And I want to, by this, I mean a strategy and intervention, the effectiveness of which has been demonstrated through scientific research. There are many other different good reasons to choose a program. I like it, people like it, they feel good, it's traditional, it's in line with our moral value, or maybe it's very visible, it makes us look like we are doing something. These are all very good reasons. But the primary reason on which we should choose the prevention that we implement is the fact that it has been demonstrated through scientific research to be effective and to really prevent that use. It's a bonus and it's wonderful if people are happy to participate in the program. But we really want to show that less drug use started as a consequence of our programs. And this is the kind of study that I showed you before. Now, those kind of studies are not that easy to implement. And I want to use a little bit of a metaphor. Some of us are amazing tailors and seamstresses and tailoresses. I don't know the wording properly, but very few actually are. And it's just easier to buy a ready-made suit. And I think that for our clothes. So I think that, you know, it's a similar metaphor. It's just easier to get a program that has been found to be effective through scientific research elsewhere than creating a new one. There will be circumstances where this is necessary because there is no other evidence-based program. But I would also invite you to always think that and to look around and contact us. We can help you. Contact our colleagues at the EUDA. They have set up a wonderful database for you, looking at all the evidence-based programs that have evidence of effectiveness in Europe. So there is a very good basis to start. And once you have chosen a program that looks good for you, try it on as it is. Don't start breaking it down immediately because you think about changing it. We have very good guidelines on how to systematically adapt and pilot evidence-based programs to your reality and circumstances. We can help. The EUDA also has some very good tools in the context of the EDPQS, the quality standards. So there is help out there, and we would love to be in touch and support you in many, many ways. So these are, for example, examples of the family-based prevention programs that you can find in the exchange, the database of EUDA, and some of which, like Unplugged, we also have been piloting and adapting all around the world. But there will be times where you cannot access an evidence-based program. And here I want to invite you to use the standards. Why? Because in the standards, for each one of the interventions, we have a list of do's and don'ts, characteristics that have been associated to the programs that are successful, and characteristics that have been associated to the programs that are not successful. So if after this webinar you go to the prevention education page, page 21, you will find a lot that also the State Secretary was mentioning, because we have very strong indication of what works. And it's all around those social emotional learning, those resilience skills, and discussing immediate and appropriate perceptions of risk and of normative behavior. But also being interactive, having very strong series of sessions, and loads of don'ts. Don't use only lecture, don't use care tactics, and so on. And what you can do, even if you cannot start from scratch and implement an evidence-based program, you can still look at your program, look at the standards, kind of, how can I say, compare the two and improve. And that already will be a good step towards having effective prevention. Last but not the least, if possible, start thinking beyond one program, start thinking about the system. There are many vulnerabilities, so there are many settings that we can and should be working. And here I want to show you this graph. This is from a study in the US, and looking at preventing the prevalence of non-medical use of prescription opioids. And here we are following kids from when they are 12 to when they are 18. And you can see that at the beginning, the prevalence is almost 0. And in the gray line, the control group that did not take part in the program, the prevalence goes up quite a bit. In the green line, the kids only took part into a school program when they were 12. And you can see already the prevalence is lower. And it becomes even lower in the group of kids that took part into a school and a family-based program. And so really, I want to show you the power of the synergic power of having many different evidence-based interventions in different settings. Another thing that I want to show you from this graph, and is something that the State Secretary also mentioned, is we need to keep a long-term perspective in mind when we are talking about drug prevention. If we had done an evaluation at 1 year only, look at this, 1 year only after the program, we might have been very, very depressed. But look how waiting and following up the children showed us that there was a really strong effect from these kind of programs. Of course, you will not be able to do this kind of evaluation all the time. That's why it's good to invest in strong evaluation and then use programs all around, adapting them to local circumstances. And here I want to show you a couple of news about of things that we are doing to put these things into practice. I told you about in our family skills program. We are also using evidence-based school programs all around the world. But we've also recently launched CHAMPS, which is an initiative where we will not do one program in many countries, but we will go into a few countries and we will do the entire system. We really want to wrap around the development of children from birth to when they are 18 and show the power of this approach. Wish us luck. We have just started, but we have many countries that have expressed interest. We are starting into a couple of countries. Maybe Finland would like to consider. In any case, I think that this will be an experience. I'm hoping it will be an experience of relevance for everybody. And in this context, something that you might also want to think about is we don't want to go into any country and say, like, what you're doing is wrong. Let us tell you what needs to be done. No. What we will be doing is to start to working together with the countries and see, okay, so let's see what you have and how much it is in line with the standards. And therefore, then we can decide together what is the most pressing to improve. And with this, we are using a tool called REPS. We have implemented it in Norway. We are starting soon in a couple of the CHAMPS country as well as in Ireland. So and this is a tool that can be used independent of CHAMPS, of course. So to anybody who is interested to see how does my drug prevention system look like? Is it in line with the standards so that we can improve? No judgment, just improving together. And finally, a couple of extra things. So the standards are a picture of the science at a certain point. Science is slow, and the State Secretary was mentioning the issue of social media. We have started to be moved to the best of our abilities. If you are interested and involved, do get in contact with us. We are developing 2 new tools. One is this one. Friends in Focus is a new peer-to-peer prevention program that we have developed specifically for the ages 15 to 18, because we couldn't find many evidence-based programs for that age. And at that point, peers really take over. So we are hoping to create a new movement. We are piloting this, so watch this space. Hopefully next year I will be able to come back with some evidence of effectiveness and really be reassured that this is something that can be used. And the other thing is that we are looking into all any, and if you have any, please do get in contact, any initiative doing drug prevention through social media. We have found quite a few. Very few are evaluated. We need to do better, and we have started working in this space. So do get in contact if you're interested, and hopefully again soon we will be able to come back to you with some ideas and guidelines. But here really this is a new frontier. We are all grappling with the same problems. And with this, let me thank you so much for your attention and for being available and working together for the healthy and safe development of children and youth, and of course the health and well-being of all, also adults. Let's not forget ourselves. And do get in contact in any way if you're interested, if you have questions, if you have suggestions, if you want to work together.
Thank you, Giovanna, for really interesting presentation, and at least I learned lots of new things about evidence-based drug prevention. We have one question here through the Q&A from Lauri Beckman. And he asks that, it often seems that in society and in the school setting, the most vulnerable group of young people are the most difficult to reach. This means that strong evidence-based programs actually end up working with young people who don't need this intervention as much. As most of these interventions are voluntary, how can we increase the necessary reach?
That's a really, really good question. So I should add another message to my presentation. The table of intervention that I showed has a mix of intervention, has interventions that are good for everybody at the universal level, where indeed your youth that seem not to need it participate. It's also very good to work with this group. We want to reinforce their capacity to cope with negative behavior, with negative circumstances, and reassure them, in their healthy choices. So all good. But also there are interventions that are specifically targeting more at-risk youth or more at-risk communities, and also group individuals that might be at very personal risk or even have started to use. This kind of intervention normally are more intensive because this group does require more work and have inbuilt very, how can I put it, also intensive components of reach out. There is no way around it. You just need to work harder to get this group. And when I'm talking about the system, it's true, I was talking about ages, but really the matrix that I show also looked at all of the levels of risk to make sure precisely that this kind of intervention reach what those that need. And also there are some interventions like, for example, good behavior game that are really amazing because they can be provided to everybody, but they are most effective for the youth, the children at risk, without having to select them and without having to stigmatize them. So there are different solutions there. I stop there, otherwise I keep on talking and it's already too much time.
Yeah, that was a really good question and really good answer. Thank you, Giovanna. I had one question also. You shared some studies about how they have evaluated the preventive programs. And I was thinking how we could, in national level, evaluate preventive actions that we are doing, for example, in Finland, because as State Secretary already mentioned, uh, NGOs in Finland does lots of preventive work and implement these programs, and we don't have the resources uh, to do those evaluations or research to what are the effects on the preventive practices that we have done. So do you have any ideas for that?
I do have ideas, but there is no easy fix. So one of the ways in which we have got around this for us is to piggyback essentially on programs that have been evaluated thoroughly, like the ones that I showed to you, and be very careful in the implementation and do a simpler but still rigorous kind of evaluation when you adapt so that you can extrapolate at national level. This is far from satisfactory, but it's something. It's also far from satisfactory because it doesn't account for the synergic effect of the system, which should be there. And this is something that we will need to grapple right now when we are starting to implement CHAMPS. So there are no real very good guidelines on this. Most countries are doing prevention at such small level that it doesn't make sense to invest to the evaluation at national level. But you are in a different position, and the countries that will work with us on CHAMPS really have a commitment to invest significant resources in prevention. So anybody who is interested, please keep in contact with us. I will keep you in contact with Wadia Malouf, who is my colleague, who leads all of the prevention program in our section, and especially CHAMPS, as he will be developing the methodology. So we will also have some maybe good ideas. Maybe we do another webinar another time next year or so, and there should be some new developments.
Thank you, Giovanna. And I think next webinar would be really, really useful. And also the social media, drug prevention in social media would be a good topic for the next session. Thank you so much, Giovanna. I know that you are hurried to the next session, so I thank you that you were able to be here, and we had a privilege. So next we have Dr. Anne Bergenström from European Union Drug Agency. Anne is a scientific health analyst and will shed light on drug situation in Europe. Anne, please go ahead.
Thank you very much, Heikki, and hyvää huomenta Lissabonista. I will present in English because the webinar is in English, but I was born in Finland, so I'm a kind of an expat Finn. So I'm very pleased to be part of this webinar today. So distinguished participants and panelists, a very warm welcome and good morning from Lisbon in Portugal. Let me just try to find my slides here. Heikki, can you please confirm you can see them?
I see them. Thanks.
Yes, good. Okay. First of all, on behalf of the European Union Drugs Agency, I would like to thank the organizers for inviting our agency to address the webinar today on this very important topic. I will begin by presenting an overview of the current situation of drug use based on the European Drug Report 2024 Trends and Developments, which is EUDA's latest annual review of Europe's drug situation. And I will then touch briefly on the topic of prevention. So this is our flagship report, the European Drug Report, which is published once a year in June. It is accompanied by what is called the Statistical Bulletin. So what the report tells us is that the report focuses on illicit drug use, related harms, and drug supply, and is accompanied by the statistical bulletin, which is web-based, where data underlying the analysis can be found. The report, EDR, is available in 25 EU languages in a digital format. The analysis also draws on the EU drug markets analysis report and the European Health and Social Responses Guide and accompanying mini guides, as they are called. I would briefly like to introduce the European Union Drugs Agency because this year has been a year of transition. After nearly 3 decades of the European Monitoring Center for Drugs and Drug Addiction, EMCDDA, our previous center transitioned into a fully fledged European Union Drugs Agency on 2nd of July this year. The reason for the change and the transition and a new legal regulation was that the drug phenomena in Europe has changed significantly since the EMCDDA, the monitoring center, was founded. There was a perceived need for providing Europe with greater capacity to respond effectively to a more complex and rapidly changing drug phenomena. The European Union Drugs Agency will support the European Union and its member states by providing services in 4 main areas. First of all, by anticipating new and future challenges, by alerting on emerging risks and drug-related threats, by assessing needs and available health and social responses, and by assisting stakeholders by evaluating and disseminating new knowledge and best practices, including in prevention. In addition, the a new system called European Drug Alert System will be established to complement the existing early warning system, focusing on the new psychoactive substances. And there will be new health and security threat assessments. A whole new mechanism and system is being put into place to provide member states threat assessments. In addition, support will be provided for evaluation and development of evidence-based policies, and the agency will be also better equipped to develop and promote evidence-based interventions and sharing of best practices. In addition, the EUDA will continue to strengthen the RATOX network of national drug focal points and also have a stronger international role and support European Union in drug policy at the multilateral level. So now moving to the overview of the drug situation. This is the screen capture of our website where you can find the digital European drug report, which in the past used to be a printed version, but now is fully digital. Let me just move my little bar so I can see better the slides. So what the European drug report that was published in June this year, what does it tell us? First of all, the available information suggests that the drug market is characterized by widespread availability of a broader range of drugs than in the past, with substances often available in high potency or purity or in new forms, mixtures and combinations. There is a growing diversity in the forms in which substances can be available on the market. In some cases, such as cannabis, for example, the routes of administration by which they may be consumed, with edibles and various forms of vaping technologies appearing. These developments increase concerns that the risks associated with some substances may be growing. In particular, people who use drugs may be placed at a greater risk of experiencing health problems, including potentially fatal poisoning through consuming, often unknowingly, higher potency or novel substances. trying to move on to the next slide. It's a little bit slow. There we are. A key message of this year's European Drug Report is that polydrug use consumption is common among those consuming psychoactive substances, and such polydrug use increases risk of health problems. So what is polydrug use? Let me define it briefly. Polydrug use is the use of 2 or more substances, licit, meaning legal, or illicit, simultaneously or sequentially. Substances may be sold on the drug market that contain 1 or more drugs other than the person who was buying the drug was expecting. These drugs may be either in a mixture where they intended to purchase or as a replacement for it. This means that the consumers, the people who are buying the substance, may be fully unaware of what substance or substances they are taking. And this obviously poses a lot of risks for the user. Polydrug use, using drugs in combination, can increase the risk of health problems and complicate the delivery of effective interventions, which is an issue, for example, when responding to acute poisoning due to drugs. Challenges in this area also appear to be growing, partly due to the increased market integration of established illicit drugs and NPS, the new psychoactive substances, and partly to the wider availability and use of synthetic substances. With the more dynamic and complex drug use patterns, the presence of multiple substances in most opioid deaths deserves more attention. Opioids, usually in combination with other drugs, remain the substances most commonly implicated in drug-induced deaths. And opioids continue to be involved in a large proportion of fatal overdoses. Approximately 75% of all fatal overdoses reported by EU countries. In 2022, where the latest data are available for the EU, there were 6,392 deaths due to drugs. This is a mortality rate of 22.5 deaths per million. Among those were 1,800 deaths due to heroin, and heroin continues to be present in majority of drug-related deaths in some specific countries in the EU. Most deaths are associated with polydrug toxicity, and I understand that this is also the case in Finland. Involving combinations of illicit opioids, other illicit drugs, medicines, and often alcohol. Deaths where stimulants are implicated, often alongside opioids, appear to be rising in some countries. Enrollment in opioid agonist treatment is strongly recommended because it is evidenced as a protective factor against opioid overdoses. Yet, coverage of opioid agonist treatment continues to remain low in many EU member states, even though it has been scientifically demonstrated that OAT, opioid agonist treatment, either with methadone or buprenorphine, is highly effective at reducing health problems and mortality, with 3 to 5 times lower mortality among those on OAT than those not on opioid agonist treatment. The World Health Organization, UNODC, and UNAIDS recommend that at least 40% of opioid-dependent individuals should be should be on an OAT program. So it is a very effective intervention, health intervention that both the European Union Drugs Agency and the UN agencies I mentioned recommend in countries with continuing drug-related deaths due to opioid use. I will now present a brief snapshot of the 4 main substances and the picture in the European Union, and also zooming into the situation in Finland. First of all, cannabis. Cannabis remains by far the most commonly consumed illicit drug in Europe. National surveys of cannabis use indicate that overall, an estimated 8% of European adults used cannabis in the previous year. Last year, cannabis use among EU population aged 15 to 34, which is what you can see on the map on the left-hand side, is estimated to be at about 15%. This translates to 15 million people, with men being typically twice as likely to report use compared to women. Among 15 to 24-year-olds, an estimated 18% or close to 9 million people used cannabis in the previous year. And around 3.7 million people, or 1.3% of the European population of the European Union, adults are estimated to be daily or almost daily users of cannabis. And this is the group, the daily users is the group that is the most likely to experience problems associated with problematic use of cannabis. Moving on to amphetamines, I think what's interesting is that of all the countries where data is available, Finland ranks highest in terms of prevalence of use of cannabis. It's the black bar in the graph on the right-hand side. And I think we can also observe that the prevalence of use of, amphetamines, I don't know if I said cannabis, sorry. So amphetamines ranks Finland ranks highest in terms of prevalence of use of amphetamines. And you can see in the graph that the prevalence of use of amphetamines started to increase gradually since year 2010. In general, the European picture tells us that surveys conducted by 24 EU countries between 2017 and 2023, these are surveys that group amphetamine and methamphetamine together, suggest that about 1.5 million young adults aged 15 to 34 used amphetamines during the last year. Prevalence of use of amphetamines among 15 to 34-year-olds, you've seen it's really the highest in Finland of all the EU countries where data are available. And what is of concern also is that 7 European cities across 6 countries have reported localized HIV outbreaks associated with injecting of stimulants. Then moving on to cocaine. Cocaine is, after cannabis, the second most commonly used illicit drug in Europe, though the prevalence of use and patterns of use vary considerably between different countries. Again, I think it's important to observe that since 2010, there has been a steady increase in prevalence of use of cocaine in Finland. So there is a notable increase. But cocaine has increasingly become common in many EU countries, so this is not uncommon. I'm conscious of time. Do I have another maybe 10 minutes? Okay, moving on to MDMA, which is a synthetic substance chemically related to amphetamines, but with somewhat different effects. Surveys conducted in 26 EU countries between 2015 and 2023 suggest that about 2.2 million young adults in the 15 to 34-year-old age bracket used MDMA in the last year, and with 1.1 million aged between 15 to 24 having used MDMA in the last year. Again, you can see an increase in prevalence of use of MDMA in Finland starting in 2010. I think I will move on to the next one. A little bit about particularly about a very harmful mode of use of illicit drugs, which is the injecting drug use. I wanted to draw attention to this because Finland has the second highest population prevalence of injecting drug use after Estonia. It's basically the blue square. If you look at Estonia is the highest in terms of population prevalence of injecting drug use, and I've circled Finland, the blue square, because even though the absolute number of people who inject drugs in Finland is, well, it is the fourth or the fifth highest of the EU countries where data are available, the population prevalence of injecting drug use is the highest after Estonia. So I think that is a continuing point of concern, that we should not forget that people who inject drugs are particularly at risk of drug-related infectious diseases such as viral hepatitis, HIV. And you can see on this map on the right-hand side that there has been an HIV outbreak among people who inject drugs in Helsinki. And injecting drug use does continue to be associated with a large proportion of transmission of new cases of viral hepatitis C. Now, moving on to the prevention part of the European Drug Report, as Giovanna Campello from UNODC mentioned, not all prevention approaches are equally effective, and we now have a solid evidence base for what we call evidence-based prevention programs, and Giovanni nicely highlighted some of those prevention interventions and programs that have been found, that are grounded on evidence and that have been found to be effective in preventing initiation of drug use or delay in terms of delaying drug use. What the European Union Drugs Agency has done with support from funding from European Union was to develop what is called the European Prevention Curriculum, or EUPC in short. And this is basically a handbook for policymakers, opinion makers, and decision makers, laying out the science behind prevention of drug use. The objective of the EUPC curriculum is to improve the overall effectiveness of prevention interventions across the European region. 25 EU member states have national EUPC trainers, and as Giovanna mentioned, EUDA also hosts the Exchange Registry, which is an online registry of thoroughly, rigorously evaluated prevention interventions. This is a screenshot of our institutional website where you can actually Google it and you will find it easily. I did a search for, I just put in the keyword Finland, and just to see what kinds of prevention programs come up. And there are 3 programs, and a particularly well-known one is the anti-bullying program. Not all the programs that are included in the Exchange Registry focus on prevention of substance use, but many of them do. In Finland, 3 programs that actually focus on anti-bullying or prevention or delaying of smoking have been found to be either likely to be beneficial or possibly beneficial. So the Exchange Registry gives us information or examples from other countries and Finland for prevention programs that are likely to be effective, but you need to look at the rating by the committee that basically evaluates and reviews the programs and whether they merit to be included in this registry. There are currently about 22 prevention programs included in the registry, and another several programs that are in a waiting lobby, yet to be reviewed and assessed whether they can be included in the registry. In addition, the European Union Drugs Agency has what we call the best practice portal, and this is the portal of evidence. It's an evidence database, and again, you can search. You can use key search terms for either by type of substance or the desired outcome. And here I just chose from the drop-down menu, reduce substance use, as the desired outcome. And here you can see some of the evidence summaries and the rating of evidence for different types of programs or interventions. So this is another resource that can be used. They are freely available for anybody to access on our institutional website. The European Prevention Curriculum, EUPC, which I mentioned, has been adapted for use in Finland and translated into Finnish, as you can see. And it is being rolled out in a large number of EU countries and also in the European Neighbourhood Policy area, the broader Europe, including Ukraine, Georgia, and other countries. And I believe Hanna will share us more about the EUPC and how it's being used in Finland. So what is interesting here, you can just see the number of EUPC trainers who have been trained by the EUDA and who are fully accredited, including 2 individuals in Finland, to roll out and make most use of the EUPC training resources and materials. So these national EUPC trainers are accredited and recognized by the European Union Drugs Agency as fully qualified and equipped trainers who can train onwards and roll out the prevention trainings at national level. I'm coming towards the end of my presentation, but I would like to highlight the EU Drugs Strategy and Action Plan for 2021-2025, because for the first time, the EU Drug Strategy in the point 5.4, it recognizes or draws attention to the European drug prevention quality standards, the UNODC WHO international standards on drug use prevention, which Giovanna mentioned or introduced, and the European prevention curriculum. The strategy is accompanied by the action plan, and one of the actions, number 30, is basically it calls upon member countries to promote and allocate sufficient funding. And I'm not going to read out everything, but it's really action 30 focuses on the importance of member states in rolling out evidence science-based drug use prevention using the quality standards, the international standards on drug use prevention, and the European prevention curriculum. So prevention is one of the many priorities within the EU drug strategy and action plan. And finally, I would like to mention that different countries they use different prevention approaches. Some of the countries tend to rely heavily on what we call manualized approaches. They use prevention manuals, whilst other countries such as Finland are well known for making use of what we call environmental approaches that reach large numbers of people or the entire population or vulnerable sections of the population through environmental systemic approaches. So I think there is a lot of variation in terms of what kinds of prevention approaches are being implemented in different EU countries, and Finland is particularly well known for the environmental approaches. And I think the anti-bullying program was an example of those. I would like to end my presentation by raising a couple of questions for reflection. And I think it's very important when we all, Heikki mentioned that budget is scarce, resources are scarce. So it's very important to reflect on what kind of prevention program or intervention can be most effective in our country, Finland, and how effective are the programs? Because as Giovanna also mentioned, some programs are more effective than others. For some interventions, there is a solid evidence base, while for other prevention interventions, there is a limited evidence base, no evidence, or even worse, some prevention interventions have been found to be harmful. They do not produce the intended outcomes. So it's very important I believe, for policymakers to review and assess what is the evidence behind each and every program in order to make informed choices about the most effective prevention programs that can contribute or achieve the intended outcomes, meaning prevent particularly young people from starting drug use or delaying initiation of drug use. And then secondly, given the overall situation of drugs in Finland at the moment, with an apparent increase in number of drug-related deaths, I think that there needs to be a public discourse among the policymakers about appropriate balancing and budgeting of prevention, harm reduction, and treatment interventions. So these are just some questions for reflection, and I'm sure our ministerial advisor, Elina Kotovirta, will perhaps touch on some of these. I'm looking forward to hearing her perspectives. And thank you very much, and I hope I didn't go too much over time. Thank you.
Thank you, Anne. You certainly had a really interesting presentation, and I learned lots of it. And luckily, we have Elina here to get answers to your questions. At least I hope so, and reflect on those. And I think understanding how the drug situation evolves in European level is something that we can learn from, and learning from different countries is crucial to find those also solutions for in our national situation. But before I open up the floor for discussion, the questions, I'd like to invite Dr. Elina Kotovirta here to give us a commentary speech about what Anne just said. So please go ahead, Elina.
Thank you, Heikki, and good morning to you all, and thank you, Anne, and of course, thank you, Giovanna, who already left, but it's always refreshing to hear her, and also from the EUDA point of view. I didn't prepare a PowerPoint presentation because I thought if I make an actual commentary speech, it's supposed not to be prepared slides. But then I noticed my greatest default is now that you actually see my full face on the, and not some kind of graph, which, you know, I should have maybe had more preparedness on this and have at least like one graph or the logo of the ministry instead of you staring at my nostrils very deeply. Well, so many interesting points in the EUDA presentation, and really it reflects many of my drug problems that I have in my life and in my work. First of all, if we also think of the aim of this seminar, speaking about prevention, we have so many drugs. We have so many different, like if we compare to alcohol or tobacco and nicotine, we have so many drugs, so many different styles of using, so many different, whether you are a problem drug user, whether you are just an one time tested something, and now we try to put this whole thing together and try to like speak only about drugs, you know, as they were one entity. So whenever, of course, when we are thinking of prevention, as already also Giovanna pointed out, we really make, and also in Anne's presentation, the distinction between prevention, risk reduction, harm reduction, it is really important how we make different policies. But still, kind of in the common speech, in the speech of politicians, it's so easy to speak about drugs generally and think kind of this one-size-fits-all model that would be, but definitely, at least in my work, I try to point this out, that we need different options. And I, of course, know that you there behind the screens that are much more professional in prevention than I am, know this also very well in your daily work. Then, of course, there is the data, which we need, and it is very well pointed out in the previous presentations. from our point of view, the numbers, they are in many ways worrisome. And of course, we have these new ways of exploring the data that is not always reflected in these data sets. So, of course, it is also important to acknowledge that data are collected differently in different countries. But in Finland, we tend to be very thorough. And it's very interesting also having the discussions with other EU colleagues who, for example, feel that their drug-related deaths are very much underestimated. And also, if you compare some countries with their results with the wastewater analysis and what they get from their national surveys, that seems the picture comes very different. So we do actually do comparison on the national surveys and also with the wastewater. Also, of course, considering all the time the problems they have with the wastewater, what kind of conclusions you can make from the wastewater analysis. But obviously you need. But anyway, you can always compare with Finland. We can always compare our own data, even if we are not so keen of saying that we necessarily have the worst situation in some cases. It's just that, and we then rather compare us to the Nordic countries, because with the Nordic countries, we do have kind of similar ways of collecting data. And of course, this is a hard, I totally understand that EUDA won't comment on this one because they are equal for every country and they trust every, but as a national representative, I can say this, even if it's diplomatically impolite, but anyway, we of course have to follow the national data and see the comparison and what are there, and this we of course believe in the kind of the national comparison. But it's also important thing mentioned actually of the polydrug use, that is also now very much discussed in the EU fora with other colleagues. That's unfortunately, I might say, other EU countries are following Finland's shining example of polydrug use. And now some colleagues are actually consulting me on the issue because they just now had kind of realized, or the use of benzodiazepines, for example, boosting either drugs and now even combined with more alcohol, is now seen also more in the, if not in the data, at least it's worrying also in other EU countries. So that is, but what we know that's always been the problem in Finland, polydrug use. That's not in common for us, but it is an interesting always how one way different Finland is with the data, and then of course there are similarities. So we are increasing in that one and that one, but still it doesn't stop to amaze me how separate kind of drug use patterns we might have even in neighboring countries. If we compare Finland, for example, to Sweden or to Estonia, it doesn't, and we don't have any explanation, like proper explanation for that. Why sometimes the drug situation is very local. And then coming to the topic of prevention is of course that we seem to be doing quite. Well, obviously we don't know everything and it's very hard to say, but early prevention, like general prevention, school prevention, we seem to be doing also something right, I think, because if we just don't put all the data like from the EUDA together, but look at, for example, the EHYT data, which is yet again already out from Finland, but not the comparison data. The EHYT data shows that we are in the lower quarter, in the 15-year-olds, like the cannabis use and all that. We are there in the very lower corner of the Europeans. So kind of underaged Finns are not so much, at least according to this data, are not so much using drugs as comparison in France or Germany or somewhere else. And I don't know if that's the do anything. I of course believe that it's doing, for example, the good work that is done in schools by the NGOs, by the other, and also the long tradition of having this health education as a school subjects for already 20 years in Finnish schools. So that's why it's for us, whenever we fill a survey or send data to EUDA, it used to be more questions about how many programs you have, how many programs of this and how many. We don't have programs. We have this curricula that it's inside there. It's for everybody. So now, luckily nowadays, of course, as we saw from Anne's slides, that you do this difference between the programs and this kind of general thing. But in like 10 years past, we were like blank. We weren't doing anything because we haven't been, taking all these programs to Finland. But Finnish school teachers are highly educated people. They have like health education is a special subject with the specialized teachers. So that I think also has to be taken account, and also kind of general health and well-being, as Giovanna also well put it. It's not just prevention, addiction, something like that. It's kind of the general health. But somewhere in there, if I can say that we are doing something, I think we are doing something right with like general prevention. There's the polarization, of course, and this we see in all kind of health things. I mean, most of the Finnish youth they are feeling better and better every year. The nutrition, their alcohol use, all this does it actually mostly getting better. Their health is getting better. But then we have the minority that is doing worse and worse. So how can we? There's kind of a lot of probably development work to do. How do we address this polarization? How do we see that? Of course, things we are doing good, that's fine, but definitely, as Anne also said, where are the things that we can do better? What is the kind of and if we think about youth and especially this data on the drug-related deaths, which is also for very young people, under 25-year-olds. So where are the places that we can actually inform and prevent harmful polysubstance use? Where is the information? Can we give it by information? What is the place? What is the time? What is the understanding that we can give to young people who use drugs for them to better to understand the situations? Already the Finnish Red Cross has started in Finland special first aid courses for people who use drugs, and in there also having also kind of information on how to operate on the overdose situation, but also kind of taking on board now the fact that it is the kind of the trying to get the understanding of the polydrug use, because there is the of course the worries. We very often say that, oh, there might be fentanyls in the tablets. You're taking benzodiazepines, but there are fentanyls in it, and that will kill you. But actually, Finnish data shows that that is not the worrisome thing. Actually, not yet, at least, luckily. But it's just that people are taking benzodiazepine in the therapeutic level. If I would take the pill, nothing would happen. I wouldn't die. But in combination of these different things, even in these therapeutic doses, these things can be lethal. And I think also that this is a very hard message to convey. It's a very hard, to understand that thing that a cure can really be a poison, and it really is the matter of the dose, and the dose can be really small. So I think in this kind of like risk prevention, we really need new measures, new ideas, new things. How can we convey this message forward? It is so if we say that in basic prevention we're doing quite okay, I think. And of course there are new things, the digital ones. We know that there are a lot of challenges, but I know you guys there behind the screens, you are doing already very good job in that one. But what is kind of the risk thing? How can we actually achieve these people? So just to quote Giovanna, really, I think she said that it's maybe naive ideas, but still, yes, earlier the better, and it's never too late. And I think also this kind of, I think we have grasped the earlier the better part of this, but maybe the never too late is something that we really need to maybe emphasize. So we wouldn't think that anybody's kind of lost case, or we wouldn't think that there isn't something that we can, okay, we take these wonderful, shiny-eyed, clear-eyed school children and keep those who are already healthy and their parents are supporting them and wonderful, and they have so many protective factors. Yes, we keep this crowd healthy. Yeah, and now we succeeded. But kind of also the thing that what is this this smaller portion of people who are, or young people who are not feeling well and who have other like more risk factors, and maybe their life paths aren't like paved with so easily as some others. So how can we help with that one? So definitely the quality of prevention is a thing that has been discussed in Finland in recent years, and maybe or already 20 years back. And I'm happy to say that actually our National Institute is yet again gathering forces on also concentrating, like with municipalities and different areas, and of course the NGOs also gathering work for the quality of prevention to get that work going on. And at the same time, I really congratulate all of you of your great work around, because definitely this is something we need to do together, and we really need all the brains to tackle these problems we have. Thank you.
Thank you, Elina, for your comments, and I will let Anne, if you have any comments from yourself to add what Elina just said.
No, I think Elina highlighted many of the much of the progress that has been made, and I was very happy to hear about that. This health.
I think, Anne, your mic went off.
Oh, I'm so sorry. So sorry. I don't know what happened. I unmute it and then mute it again. So I think what Elina highlighted much of the progress that has been made, some of the current approaches and what the country is paying attention to. Very, very interesting highlights. I think what struck me is that this national health education that has been mainstreamed into the school curricula, which is a very excellent example of what I consider the environmental approach, because it's something that will reach more or less each and every school pupil. And this is absolutely fantastic, because when I recall my years in school in Finland, in Helsinki, in the 80s, there was no such thing. And there was a one-off visit by a police officer who came to school and addressed the school assembly in the morning, talked about the dangers of drugs. So I think there has been, obviously, we have moved on since then, and I was very happy to hear about this health education having been mainstreamed into the national school curricula. And I think this is an example, a best practice example that could be highlighted hopefully by Elina when she attends the management board meetings and she's a member of our EUDA management board. So this is definitely what I consider a best practice, good practice to highlight from Finland to other countries in the EU and beyond. So I think there was a lot of food for thought in Elina's intervention and statement. So very happy to have heard her reflections. There was a question for me in the Q&A from Jukka. I don't know, shall I briefly respond to that?
Yes, I can also...
Or shall I respond by text? I can do either.
You can respond it to everyone. So I can ask the question so all the participants knew what has been asked. So Jukka asked that given the growing attention on performance and image-ending drug use in Europe, particularly in the Nordic countries. Are there any ongoing or planned initiatives to include PIED trends in future in EUDA reports or studies?
Thanks, Heikki. So it's a very good question, Juha, and I'm pleased that you are participating in the webinar. Performance and image-enhancing drugs is already something that the European Union Drugs Agency has looked into. We have a dedicated web page, and I will try to share it in the Q&A chat in response to Juka's query. In addition to the dedicated web page with general information about the harms, giving an overview of this performance and image enhancing drugs, there is also what we call a background paper. It's called Health and Social Responses to Problems Associated with the Use of Performance and Image Enhancing Drugs. It was published by European Union Drugs Agency in 2021. So it is quite recent, and the web page was updated just last year. So I will try to post these two links because something very specific, but we have some information on our website. I don't think that the RADOX network of national focal points report on an annual basis on these types of performance and image enhancing drugs. I have to say I would need to look into that and get back to Juha later on, but we have some information and a report. Thank you.
Thank you, Anne and Elina. It was honor having you both here and hearing your ideas about this issue at hand. Finally, we will hear from Hanna Heikkilä, expert in substance use prevention. Hanna has worked in various roles within national and international organizations, and today she will present a solution developed by EHYT in the field of drug prevention. Hanna, please go ahead.
Thank you. And just a second. I don't present too often in Zoom, so let me wait until the presentation opens. And thank you so much for this opportunity to speak after such an amazing and insightful speakers, to introduce few examples to the end on what we here at EHYT are doing in order to prevent substance use. And actually, increasingly also what we are doing to prevent specifically the use of illicit substances, which is increasingly something we have to think about, as we just so convincingly heard from Ms. Bergenström's presentation. And actually, that's also a message that we every now and then also get from our stakeholders in the field, that they feel that since these new substance use phenomena and harmful consequences of drug use are so much on the agenda, they sometimes feel that the traditional methods of substance use prevention might be inadequate, and hence there might be a need for support in how to provide even more comprehensive prevention for preventing all types of substances and the harms arising from them. And consequently, after a few examples on what we do in prevention directly, I will tell a few examples on what we do in order to build capacity for evidence-based prevention. And we work nationally via our 8 regional offices, our 120 plus member organizations, our volunteers, our staff, in order to support healthy lifestyles, well-being, both at the individual level, at the close environments of individuals in schools, families, workplaces, leisure time surroundings, in communities, for example, within the context of implementation on alcohol and tobacco and gambling policies. And very, very importantly, we also work a lot at the level of society at large, advocating for nicotine, alcohol, gambling policy that are grounded on public health thinking.
Anna, I will stop you for a moment. Your slides aren't changing, so they are not in the presenting mode. So if you can...
Okay, let me stop sharing. Thanks, Heikki, so much.
No worries.
Good, because I saw everything perfectly. So let me try again. Here. It is a slightly... Okay. And can you now see the one slide normal presentation?
No, still there is the mode that it's not presenting. It's like all the slides are visible.
Okay. So sorry. Okay, I try one more time and then I just present. Is it okay like that?
Yes.
Good. And apologies for all the persons in line having to wait for this. But now is it still like all the slides or presentation mode?
It's still all the slides. So there's something technical going on. But if you can just scroll those slides so we can see all the what the slides are saying. So just continue.
Yes. Yeah. That's good. And I remember what I was planning to say. So good. So a few examples on what we do. For example, you were just speaking a lot about the excellent situation that we have in educational institutions. And this is also a context where EHYT supports teachers and other personnel to do their job as well as possible. And we are training educators, annually around 5,000 educators, and providing them with many kinds of materials that are free to use, for example, in health education classes, or for example, during recess, or for school youth work, or so on, from our websites. And we meet with students all the way from the very youngest school children for whom we provide life and social skill classes through the teenage years where we provide substance use education through upper secondary school and even to universities where we support, for example, student unions to create safe spaces and do some easy brief interventions, which are all approaches that have also been shown to prevent the use of illicit substances, as Giovanna so nicely told to us. And this is an important approach for us at EHYT, how we reach children at universal level as discussed. And of course, we need to go to where the youth are themselves and try and reach them also via social media, which actually also allows to target the messages a bit more to those already encountering more substance use related issues in their everyday life. But then at the more selective and indicated level, we work mostly with adults, where we also support adults who are living in difficult life situations. For example, through our low threshold meeting places, mostly serving more vulnerable populations, or via our 24/7 helpline that supports people who have substance use-related problems, majority of whom are those using substances at risk levels or their family members, or via the ombudsman services, via which we do our part to ensure that everybody in need of substance use-related services has access as guaranteed by the law. And the third example of a target group we are targeting with our prevention activities here at EHYT, I wanted to show the local civil society organizations and local volunteers with whom we provide a lot of different opportunities to interact, and via whom we are really reaching significant amount of Finnish people in very different life situations, ranging from the online grannies chatting with the school children who might not have contacts to adults when they need that, to our very basic brief intervention type trainings to laypersons that allow prevention to be implemented in all kinds of everyday environments where people interact, to our new program on adapting, actually UNODC developed family skills program, Parents United, which Giovanna mentioned, to the use of local civil society organizations with the idea that testing, if this is a tool that would work also in the small organizations with the support of volunteers, we would be able to bring this kind of very important support also to those families who are not accessing services, either because they might have some barriers for accessing services, or because they might not yet have so grave need for services that they would be getting public services. We are piloting, for example, via organizations working with cultural minorities or immigrants or people with history of unemployment or mental health issues. And this is one of our efforts to also provide prevention to more vulnerable populations. And we are very, very grateful for the generous support we are getting from the colleagues at UNODC. Also in this effort to broaden our menu of volunteer-based prevention activities. And these are methods like family skills training or brief intervention that we also heard from Giovanna have been shown to be able to prevent the use of also illicit substances. But furthermore, I think we all here at the EHYT believe that just strengthening civil society and volunteer action in itself is one important way to make the entire society more resilient towards threats like the harms caused by the use of illicit substances. But for us, it's very, very important endeavor to support the capacities of a wide range of professionals from various backgrounds and sectors to implement as comprehensive as evidence-based prevention as possible, but also, for example, the recent recommendations from the Ministry of Health and Welfare that highlighted the lack of substance use prevention related contents in the decrease of people studying to work in health and social care sectors, really highlights the need of such trainings. And for this, we are very happy to have the opportunity to work alongside with EUDA to deliver European prevention curriculum in Finland. We just this year piloted the 2-day module for decision makers and opinion leaders in Finland with very positive results, providing the knowledge base on the concepts of evidence-based prevention, on the different approaches that have been shown to be effective. And furthermore, we have been piloting already or delivering and disseminating already for a few years the add-on to this EUPC curriculum for decision makers and opinion leaders, which is the EUPC package for the so-called frontline prevention workers, which means the professionals across the different sectors in municipalities, in civil society organizations, delivering and coordinating prevention in municipalities and also in regional police bodies, which by the prevention law are mandated to prevention in Finland. And these two training packages, they're both 2-day face-to-face training packages, are complemented by our online training opportunities, by this manual that Ms. Bergenström already showed to us. And they both provide an excellent opportunity to access the wealth of information that is available there, like Giovanna just presented to us in the beginning of this seminar, on what works, what kind of approaches can be effective in different life stages, in different parts of communities and societies. And we are happy to continue to disseminate these trainings yet to new municipalities and to new regions and their prevention coordinators. So far, we have trained over 100 professionals from various backgrounds with the frontline body TEIA, in Finnish the monialainen ehkäisevä päihdetyö kunnassa workshop, and it has clearly been able to shift the understanding on what types of approaches have the possibility to really impact substance use behaviors. But much more importantly, we have the experience that these trainings have been able to impact the motivation and readiness for these professionals to take all this information and understanding to their everyday work for the benefit of the citizens, to really make sure that we do as ethical and as comprehensive and as effective prevention as is possible within the multisectoral coordination. And we continue to deliver these workshops to municipalities directly, typically to the multisectoral coordination bodies in municipalities, but also we are offering the EUPC module for decision makers and opinion leaders, eurooppalainen tietoperustekoulutus in Finnish, and next time in early June. So I would be very happy if this channel for accessing all this information and tools how to yet improve our prevention, which is already very strong in Finland, would find its audiences. And thanks again and for having this opportunity to introduce what we do, and sorry for the hassle.
No worries, and thank you so much, Hanna, for sharing the light what EHYT does and what kind of work we do. So unfortunately, we don't have any time for questions for Hanna, but I thank you so much. Then I will be wrapping up this session and thank all of you who joined today. I hope you have gained new insights into the drug situation in Europe and how we can prevent the drug use, and at least I will use the European register for the good practices after this and find new ways to do drug prevention in Finland and what we could do in EHYT as well. And especially thanks to all the experts who we had pleasure to having here, and you had time to share your knowledge to us. I might be biased to say that this webinar was success since I was the organizer, but I will say it anyway because I learned so much. I believe that preventing drug use requires careful forecasting of trends and policies at national, European, and international level. This is why it's so important that we share information and ensure that we all have clear and unified picture of the situation. As final note, we will share the materials with all of you, including the EUPC guidelines in Finnish, and also I will share the link to the online course that EHYT organizes for the EUPC. And as I said, start of this session, we will be sharing also the recording of this session to all of you after we end this. So thank you all once again, and I hope to see you also at the future events. And have a great day, everyone.